All right, today we're putting on our detective hats for knees. We're going to dive into a really simple, hands-on test that can solve a painful mystery that, believe it or not, even an X-ray sometimes can't see.
So picture this. You're out there playing a sport, maybe just making a quick turn, and then bam, you hear it, that dreaded pop from your knee. It's sharp, it's sudden, and oh yeah, the pain that follows is immediate.
So you do the right thing, you go get it checked out. The pain is absolutely real, and your knee's starting to swell up. But then the X-ray comes back and it says, everything's normal. The bones look fine. And this is such a common and honestly a really frustrating spot to be in. It just leaves you thinking,
right, if the bones are okay, then what is causing all this pain, all this instability? How in the world can a doctor figure it out when the very first images don't show a thing? Well, it turns out there's a classic hands-on technique that just cuts right through the confusion.
And it's called the Lachman test. This isn't about some fancy, high-tech machine. Nope, it's a physical exam, a really skilled maneuver that's designed to check the health of one very, very important ligament in your knee, the ACL. And the real power of this test? It's the speed. I mean, this isn't about waiting around for days for some lab result. A skilled examiner can get a pretty clear idea of what's going on right then and there. It's like finding the instant clue that solves the whole mystery.
And that's what's so brilliant about it. The Lachman test isn't some general, all-purpose tool. It is a specialist. It's designed to interrogate one and only one structure, that anterior cruciate ligament. It's looking for a very specific problem in the knee's support system.
So how does this knee detective actually do its thing? Let's get into it and break down exactly how it works step by step. Okay, the whole process looks deceptively simple, but it is incredibly precise. First, you just lie down, relax your leg, and bend your knee just a little bit, maybe 20 to 30 degrees. Now that angle is super important because it helps relax your hamstring muscles. Next, the examiner uses one hand to get a firm grip on your thigh bone, that's your femur, to hold it perfectly still. And then with their other hand, they take hold of your shin bone, the tibia, and give it a gentle but very firm pull forward. And right here, this is the moment of truth. The whole diagnosis, everything, comes down to what the examiner feels during that quick little pull. It's not just about how far the bone moves, but the quality of the stop at the end. So, what's the secret their hands are trying to uncover?
Well, here are the two things that can happen. In a healthy knee, that ACL is like a strong, tight rope. So when the examiner pulls your shin bone forward, they feel a solid, firm stop. It's like hitting a little wall. But if that rope, the ACL, is torn, there is no solid stop. The shin bone just keeps moving forward more than it should, and that endpoint feels, well, kind of mushy and vague. That extra movement, that's the telltale sign of a tear.
And getting this diagnosis right and getting it right away is just absolutely critical. This isn't just one test among many. In a lot of cases, it is the most important test in those first few moments right after an injury. The reason it's so vital all comes down to its sensitivity. For what doctors call acute trauma, a fresh, brand new injury, this physical exam is considered the gold standard. In those critical early hours, it's often way more reliable than any other physical test they can do. And this brings us right back to where we started. Remember that frustrating X-ray? It only shows bones. The Lachman test is checking out the ligaments, the soft tissue that an X-ray just can't see. So it finds the real source of the problem, giving you an answer when other early tests just come up empty. So here's the bottom line. In the world of new knee injuries, skipping this simple hands-on test is a huge risk. It can literally be the difference between getting a fast, accurate diagnosis and sending someone home with a really serious injury that just goes completely untreated. Missing the test can mean missing the diagnosis, period.
It really makes you think, doesn't it? In this age of crazy advanced medical imaging and all this technology, sometimes a simple, skilled physical test can still be the most powerful tool in the box. It kind of leaves you with a pretty cool question. What other secrets about our bodies are just waiting to be unlocked by a simple physical exam?